Recording is on.
Hello. Good evening, everyone. I'm Dr. Farooq from ER Skill Lab from UK. Today we have Dr. Adiba Matin with me, who is a emergency medicine physician from Kansas City, and she graduated emergency medicine residency from Mayo Clinic. She was born and raised in the United States, and we are really excited to have her today. And she also spent quite some time in Bardem Hospital in Bangladesh doing her residency. So Dr. Adiba, I think emergency medicine community in Bangladesh is really excited to hear the story from your side. We don't have too many people doing emergency medicine residency in the United States from Bangladesh background. So would you like to tell us a little bit about your journey in emergency medicine and why did you choose emergency medicine and what's your story? If you just tell people, our audience, please.
Yeah, sure. I would be happy to. Assalamu alaikum, everybody. I'm really excited to be here. My story to emergency medicine is kind of based on personal experiences. I grew up in the United States, but both of my parents are Bangladeshi. And my father actually passed away very suddenly when I was in high school. And uh, losing him and my experience after the fact with the healthcare system made me want to become a doctor and made me want to help people, particularly in their time of need. And what drew me to emergency medicine was I could be that person for those people. I really liked the ability to be somebody different for each patient. You have to wear a different hat for each patient in emergency medicine, and that keeps the specialty very interesting, exciting, but also very rewarding. So that was my reason for going into the specialty, and I feel very lucky to have the chance to be able to do so.
Oh, thank you. I mean, you know, I would like to explore a bit more because you've done your medical school, your residency afterwards. But while you were in medical school, is there any particular moment that suddenly, because you probably rotated in other specialties, so is there any particular moment that you had a transition in your thought process that, oh, I'm not going to go to medicine, surgery, I want emergency medicine. Like, what was the the situation around that time, like what happened in your mind?
Yeah, that's actually a really great question. I was the last person in my medical school to choose my specialty. Actually, I struggled a lot, and I think ultimately I realized that I liked a little bit of everything. Every specialty that I was in, I was like, oh my gosh, I want to do this one and I want to do that one. And initially, I thought I would go into internal medicine. And then I had this really awesome mentor in vascular surgery. So then I kind of got swayed a little bit, and I realized I really liked doing procedures. I realized I really liked kids. So getting the mix of, the entire age range of patients, the entire patient, population, a little bit of procedures, a little bit of medicine, critical thinking, fast paced scenarios were kind of what drew me to emergency medicine. Um, it was definitely a really hard decision, but I'm really happy with my choice because I think that every day is different, and I'm able to kind of exercise different parts of the things that I like about medicine daily.
Absolutely, I really like the thought. I mean, obviously, as an emergency physician, I think we cover all the specialties, and you don't need to take away. When you go home, you're more relaxed. You don't need to think of one patient that you need to follow up the next day. So I think it's like an on and off switch. As you go to work, you see things, and you come back home. So now, from medical student to residency, now you're attending uh, in Kansas City. Can you tell me a bit more what you're doing these days and how you're feeling about work? Can you just,
Yeah,
please? Yeah.
yeah. So I am practicing as an attending physician in emergency medicine, and I work for a private group, and I'm employed by the private group uh, in Kansas City. We work at a couple of different larger hospitals. One is a level 1 trauma center, the other ones are slightly smaller. And then we also work at a few community hospitals, which are very tiny, about 8-bed emergency departments and just a couple bed inpatient hospital with very limited resources. So the breadth of those different shifts really is very interesting because each day is different. At the smaller hospitals, you kind of have to figure out, what resources do I have and what can I do, for my patient in this moment of time. And then in the larger hospitals, you have all of the consulting services that you may need. We see lots of traumas, lots of gunshot wounds. We have all the different surgical services. So you get to learn from those specific specialties because they'll come down to the emergency department and see your patients. So, I think it kind of gives me an idea of the diversity of emergency medicine because I think that there is a lot of variation in potential careers in emergency medicine. So I feel like I'm getting a little bit of an exposure to that versus like the exposure to academics from residency.
Right. Thank you. Can you tell us a bit about your training years? You have 3 years training in emergency medicine residency, right? In Mayo.
Yeah.
Can you
Yes.
tell us how it feels like being a resident from year 1, 2, and 3?
Yeah. So residency was hard. I think any residency is difficult, and I was really lucky to be able to train at Mayo Clinic, and the progression in emergency medicine is that you get more responsibility in the department as you progress in your training. So, as an intern, you have a senior and then you have an attending, and you're kind of getting guidance by both of them in your specific pod of the emergency department. You get to help with airway, which is like, what you kind of own as an intern in terms of procedures. And then you get to do other procedures like central lines, orthocentesis, paracentesis. As a senior, which is your second and third year, then you are kind of, getting guidance on how to run a department. So, that's a skill that's different from just knowing medicine. You have to know how to manage your time. You have to know how to multitask. You have to be aware of what's going on with all of the patients in the department that are not just your patients. They're patients of the interns, they're patients of the nurse practitioner or the physician assistant. And you have to be prepared when, new sick patients come in because you are the one that's practicing leading the resuscitations. So that was kind of the difference between intern year and second and third year, is that you get your chance to lead resuscitations, which, those are the highest acuity patients that come in, whether it's a trauma or a medical resuscitation. You're the one that's putting in all the orders and calling all the shots. And that was really great training because, I didn't really get as much exposure to that in medical school, but seeing that, I think, that's kind of a unique thing about emergency medicine is being able to take care of an acutely ill patient and resuscitate them very efficiently and with knowledge of the resources that you have. So that was great training to have.
Thank you. I would like to explore a bit more because I think residency or training is different in different countries. Obviously, in United Kingdom, we have 6 years training. Bangladesh, we don't have any, but other countries have some sort of training. But my question is, in terms of rotation, like, do you rotate in acute, critical care medicine? What are the rotations look like in every year? So, do you have to rotate every year in other specialties, or what other specialties did you rotate during those?
Yeah, we did rotate. So we rotated in critical care. We had, I think, 3 months of critical care. And I think it varies depending on if you're doing a 3-year residency or a 4-year residency
Yeah.
in the US, because there is a little bit of a discrepancy there. But we rotated in critical care, we rotated in neurology, I rotated in radiology, I rotated in the pediatric ICU, OBGYN. Yeah. Uh,
So, are these like a 2-3 months rotation? You're talking all this, or is it
like a month, usually like a month
like a
long.
month long? Yeah. I like the one you said, radiology. I never heard about radiology rotation, which is nice. To
Yeah, that was an elective that I decided to do because I thought that it would really
Yeah,
benefit me because and it really has benefited me,
yeah. Mm.
practicing on my own because I feel more comfortable reading studies.
How about other like IENT or anything? Any other specialty you rotated?
So we had elective time where you could, select a specific area that you wanted to get more experience in. I didn't specifically rotate in ENT or any of the surgical subspecialties, but there were options. There were very, broad options to rotate where you wanted to do specific learning.
Thank you so much.
We did an orthopedic surgery.
Oh,
It wasn't like, a surgical rotation, but it was, a rotation with the orthopedic surgery service on reductions and uh, dislocations, sedations, those kinds of things.
that's amazing. I can already see that it's a very different mix of rotations options that we have in United Kingdom. I'll come back to it later. But the one thing I would like to bring out at this point, that you did mention, you while you were doing a residency, you had some time in Bardem Hospital in Dhaka. Can you tell us from the beginning why you thought about it and how did you ended up doing it, and what was your outcome at the end?
Yeah, that opportunity was amazing. So I got to work in Bardem for 1 month in residency. I got a grant from my residency to be able to go there. And, my intention was to go and sort of learn how healthcare is delivered in Bangladesh and see what kind of uh, opportunities there were to contribute, and learn from the doctors there. I got to rotate in anesthesia critical care with an amazing mentor that I had. His name is Dr. Kausar Sardar, and he was a really great um, form of guidance for me. He really helped me sort of understand how emergency medicine was at the time in Bangladesh. I was there in 2023.
Hmm.
And he gave me the opportunity to rotate and visit different hospitals around Dhaka to kind of see how medicine is practiced differently in those different hospitals. And there was a big range between like private hospitals versus like more public places. It was very eye-opening for me. What I learned is that Bangladeshi doctors are very smart and very talented, and um, you know what I was also able to see was that there was a little bit of an opportunity to, you know, contribute to emergency medicine because it's not recognized as a specialty there.
Yeah, thank you. I mean, you did recognize that there is a need of a specialty as emergency medicine in Bangladesh. Also, the pre-hospital care doesn't exist, and I'm glad that someone from United States actually made their way to Bardem Hospital. How did you make the connection? There are a lot of different hospitals in Dhaka city, isn't it? How did you actually choose the hospital, make the connection, and made it happen?
Yeah, I actually got connected by one of my mentors from Mayo Clinic who um, is American. His name is Dr. Grossman, and uh, and I also had mentorship from another American doctor named Dr. Bucks. They have done a lot of amazing work in international emergency medicine, and he actually had a contact. I think it was more like a friend of a friend type of situation.
I see.
And I got to reach out to Dr. Sardar, tell him that I'm interested in coming to Bangladesh, that I have, Bangladeshi roots, and a life goal of mine is to be able to contribute to healthcare, specifically in emergency medicine in Bangladesh. And he was willing to take me on as a mentor.
Wonderful. Thank you again. Um, Obviously, with 1 month, it's I think it's not too long, but it's something for you to expose to Bangladesh, and you did realize the difference in practice. Is there any particular area? I know emergency is a broad field, but in a particular area or particular thing, if like let's say if we have enough grant and have a capacity to go back to Bangladesh, what would you like to do to change the system if you could?
I think, one of the first things that I noticed that would be easy and very effective, and I think that would really impact a lot of lives, is to make tourniquets available in the pre-hospital setting and provide a robust training for tourniquet application. Because one thing that I did see was that, patients would be transported either, privately or, with
Mm.
a EMS system, and they would be bleeding. There was no resources for application of the tourniquet, or maybe there wasn't an understanding that the tourniquet might benefit the patient. And so, I think in terms of like large volume hemorrhage, which, should be a preventable uh, emergency, and it would prevent the hospital from having to use lots of blood, which I know is very limited as well.
Mm.
That would be like the first thing that I would love to see. Another thing is the availability of defibrillators. One thing that I noticed at Barnum Hospital specifically was that it was pretty difficult to get a defibrillator to the emergency department because there wasn't one there routinely. There were defibrillators in the ICU, which were a couple stories um, away, above, like on the sixth floor, I think, of the hospital. I might be wrong about that, but
Mm.
um, it would take time for the defibrillator to come
Yeah,
down to the emergency department, and even just a couple minutes can save a person's life. So that would be another thing that would be easy and very effective.
absolutely. I think you pointed out, like this is the common scenario in all other hospitals. Like, I don't think all emergencies or even critical areas don't have nearby defibrillator, within reach or within minutes. But yeah, it can be very challenging. Um,
My cat.
okay, that's nice. So tell us about a bit more. So in Bangladesh, I know it's not enough time for you, but you did rotate in critical care and anesthetics.
Yeah. I got a lot of mentorship from the residents that were there and Dr. Sardar. My Bengali is not very good, so I needed a lot of help, but I did get to see, what critical care and what anesthesia looks like in Bangladesh, and how busy they are, how many patients they have to take care of,
Yeah.
the resources that they have to work with, and really how talented they are. I was really impressed at how smart all of the doctors were there, and how much they cared about their patients. Like Dr. Sardar would make time for
Mm.
patients that couldn't even pay for the treatment, just to take care of them. And that's not something that you see commonly here. So
No, no.
I know there's a lot of resilience in
Yeah.
Bangladeshi doctors.
Yeah, that's one of the challenge, because in Bangladesh, in terms of, if you have to, have to pay for the critical care treatment, this is very expensive for many people, and not all the government hospital have a good critical care bed available when you need it. Okay.
Mhm.
And I think Bardem probably is one of the earliest hospital that had critical care as a specialty. Uh,
Mhm.
and as far as I know, I don't know if you heard about Dr. Omar Farouk. I think who was one of the emergency medicine physician from United States who went back to Bardem Hospital and started critical care medicine as a training program. Have you heard about?
Oh, that's awesome. No, I didn't know about him,
Right.
but
He was,
that's
yeah, he was from Bangladesh, but he went, and like in 80s, he went into New York for residency and stayed for 30 years, as far as I know. And then he came back because he's grew up, and then he started. I think early 2000, he started critical care as a training program for the first time in Bardem Hospital. I think now have other hospital that started as a training, which is nice. So
yeah.
so I think, yeah. So coming back to you, so I know it is, as a career, to choosing emergency medicine is not an easy thing. Career to choose even medical school is not easy thing. So in general, in your life, for example, what are the biggest challenges you face throughout your life, and have to and you overcome and you learn from it and you move on. What are the biggest challenges you would like to share?
I think the biggest challenge of my life has been losing my dad.
Yep.
Definitely. I went from like a life of being very naive and very, I had great parents. My mom is still alive and she's amazing. And I went from kind of being like a rule follower and being like a person where I was like, all right, I just need to do this, and I didn't really think too deeply about much, and I kind of just did whatever my parents told me to do. And then I lost my dad very suddenly, something that like, neither me or my mom or my brother or sister expected, and it kind of created a lot of hardship in our family because my mom really struggled afterwards to take care of the three of us. And I was the oldest daughter. So,
Well, you were
um,
still a student at that time. um,
yeah, I was still in high school. So,
mhm,
I felt like I had a responsibility towards my sister and my brother. And then my mom also wanted me to pursue opportunities. So she was like, nope, I wanted to stay nearby for college, but I got a scholarship to go to a very nice school, University of Chicago.
right.
Um, and my mom was like, nope, you're going, you're going to go and you're going to do great. And don't worry about it. You need to have, take your opportunities in life. And I've really tried to honor my parents in that way. I feel like my dad would be proud that I would want to help people. And, especially learning about the difficulties that are going on in Bangladesh in terms of like access to emergency medicine, access to pre-hospital care. I feel like there is an opportunity there to contribute something.
Yep.
I'm not going to pretend like I know everything, but
Mhm.
to contribute whatever I can to help people, I think is a very rewarding um, path, and I think it's something that I that my experience of losing my father has
Yeah.
really um, made me want to pursue.
Yeah. Thanks for sharing this difficult. I think it's unimaginable for anyone. Even I lost both of my parents relatively early stage, and I know how it feels. It is a
Yeah.
challenge. But thing is, I feel like that sometimes, yes, it is a challenge. Also, at the same time, you become more stronger. You survive and you carry on. So I would say, obviously, so you grew up without your father, or is a challenging time, but it made you much better person as a human being, I'm sure. And also, like, I always do, sometimes, self counseling, and the question is, so a lot of times I think, when things are not right, and then uh, it feels like, oh, this is the end of our, this is the lowest moment. So even those times, for example, if you ask me, I'd probably take a deep breath and start thinking around it, and try to think positive. And I always see the brighter side, and I would say, there is always a choice. So it doesn't matter what it is. So, in again, it's a tricky question, but I would say, in the lowest moment, sometimes, how did you motivate yourself to carry on?
I think perspective is a huge thing, and I've always had the thought of, I feel very lucky to be here. I feel very lucky to have this particular struggle, not like
Mm,
losing my dad, but like, if I'm stressed out in terms of like studying in school or, work or something like that, well, I'm here, and at least I get the opportunity to, grow or help somebody in some way. Um, I feel like the experience that I had, and I know a lot of people have had experienced
yeah.
loss in their life, has helped me empathize with my patients and has helped me provide better care for my patients. And even when things get hard and, you know, not things don't always go well with patient scenarios or sick patients. And sometimes you can kind of internalize that, and you can be like, wow, this was awful. Like, I don't want to see this again. Like, I don't want to feel this pain again. But on the flip side of that, it's like, wow, this was hard, but at least I did my best, and at least I was able to try to help somebody and be there for them in their time of need. And I can't think of a better way of spending your life. So I feel very privileged to have the opportunity, because I know a lot of people don't, want to get to a certain point and don't get the opportunity to get there, even though they deserve it.
Yeah, thank you. I mean, I think all emergency physician at some point, they have to be very resilient and carry on and move on forward in order to keep moving. And I think that makes a better human being and a better clinician. And thanks for sharing that. I think
Totally agree.
there are a lot of things we can talk about, but let's one more thing I would like to ask. As an emergency physician, people think is a difficult work-life balance. Okay. I know it's a very challenge when you're a trainee, it's like a resident or in training in any country. So two part of questions. So one is, during your training, how did you balance your work-life balance, and how is it now? If you can.
Yeah, that's a really important question, because there's all these studies that show that burnout is very high in emergency medicine. And, I can totally understand why that's the case, because it is a very high stress, fast paced job, and you see a lot and you carry a lot with you. And so you really have to make sure that you have ways to cope. And it's not the same for everybody. And during residency, I feel like that was my time to kind of understand what works for me and what doesn't work for me. And what I've learned is that there's a couple of different ways that I need to decompress and I cope with things. And one is being able to talk to people who can relate. And that is my coworkers, my friends, other co-residents. I need to be able to have an outlet where I can explain, what happened in a certain scenario, and they can understand exactly what I'm saying. And that's not really the same conversation as what you have with your family, who, maybe not in medicine, and they are not going to be able to understand exactly the dynamic or exactly the situation as your coworker. The other thing is taking care of yourself, taking care of your body, eating healthy, making sure you get enough sleep. Like, I will not compromise on that. Like, I am going to get 8 hours of sleep. Whatever else, has to be compromised in the day, that can wait. But I'm going to take care of my body, and I'm going to exercise every day. I'm going to eat healthy, and I'm going to make sure I get my sleep. And, I noticed in residency, when I was pushing myself a lot and I wasn't getting the sleep or eating as well as I have prioritized now, I was so stressed out. I had a twitch in my eye. I had a twitch in my eye for like months, because I just was so sleep deprived. And then finally, when I came out of residency, I got enough sleep, and I was able to make the twitch go away. And then the last thing, which is a new thing, that, I've decided is going to be part of my life for the whole time that I'm in this career, is speaking to a therapist. I think it's very important. And I speak to a therapist every single week about my job, basically, to have an outlet where, I can talk to somebody completely unfiltered and process what's happened to me. Because every day that you're working, and it's not just emergency medicine, I think it's medicine in general, you get exposed to so much trauma and so many, hardships and hurt from your patients that we carry with us. And it's hard to understand how much that affects us until, like, you realize, you're like, why am I so sad? And then, the outlet is really nice to have somebody to talk to, because then you're not, putting that on your family members or putting that on your partner or whoever, because sometimes that can burden them too, hearing very, very intense stories from your work. So those are the things that have helped me. And I actually think that emergency medicine has incredible work-life balance, and that's kind of why I chose it as a specialty. Is that when you're on and you're 100%, and that's kind of how I like to do my job anyways. And when you're off, and I'm not answering emails, I'm not waiting, worrying about pages. Like, I can actually relax, and I can actually have my time to myself and a family. And whenever that happens, I will be able to devote, my undivided attention to whatever I'm doing, instead of, worrying about if I'm going to get called into the hospital, like other specialties do.
Excellent. You explained really well, and I like the idea that you need to speak to someone. It could be
Yeah.
therapist, someone you need to vent it out, but probably not to your family members. So this is really helpful. But I think a lot of us underestimate this process of talking to someone, like especially guys like me. I really don't like to talk to people, but I even feel that yes, there are times that I feel I need to speak to someone who
Yeah.
know me, who wouldn't judge me, just to have a sharing purpose. That really helps. Thank you.
Yeah.
And I think it's not just emergency medicine, it's like all in general in life. If you have a
Agree.
lot of stress, complexity life, you need to just share with someone, ideally a therapist or someone who doesn't know you. um, and that's really good. And I like the idea that yes, emergency medicine is especially where you can actually relax. You should
Yeah.
relax. Yes, there's a chance of burnout, but you can work out around the burnout thing. uh, and you can relax at some point. And the more senior you get, I think at the time, uh, the life as an attending is not as bad as a resident, I believe, isn't it?
100%. My life is so different, and it's so much better
How
now
many
that I'm a resident.
how many days a month you have to work these days?
So this current job is 120 clinical hours a month. That's a minimum, and that's around 11 to 13 shifts a month. Which, then you can imagine I have like 19 to 17 days off, which is a lot. And at the beginning, I was like, I don't even have hobbies right now, because I've been a resident for so long. I don't even know what to do with my time. So it's been really nice. I've had the opportunity to travel, spend time with family, get hobbies, learn how to cook a little bit. So that's good.
That brings us to the next question. Normally, what do you do in your free time?
In my free time right now, I'm like on a traveling kick.
Hmm.
And, my goal is to just see the beauty in the world. And I just went to Brazil, I went to Canada, Mexico this year. I'm going to Switzerland coming up. And I hope to make a trip to Bangladesh, hopefully next January if possible.
Right.
I just learned how to snowboard. I like to exercise. That's like something I do every day without compromise, and spend time with my family and friends.
I'm impressed. You sound like a very organized person, not like rest of us.
Definitely not, but like, I'm glad it comes off that way.
Yeah, yeah. But I think it's very important as an emergency physician to take care of your health, mind, and travel and do something else. I would highly recommend everyone to do that. But I would say, many people in Bangladesh, obviously, who are still, because it still is not a specialty, they're struggling to make it as a career. So most of them actually are is easier to come to UK. So United Kingdom is probably most of their choices coming. I probably don't know anyone who is actually pursuing emergency medicine in the United States from Bangladesh. So I would say it's different. So in this long journey, I would say at the end it's still worth it. To be honest with you, I think you would agree or disagree. It's a long journey, but I think if you reach at some point, it's worth it. From being Bangladesh, the challenge is if I want to go back to Bangladesh, there's nothing there. So
Yeah, to
that,
pursue as a
exactly,
specialty.
that's a big gap. So what I'm trying to actually in this Bangladeshi medicine emergency medicine community, I think all of us we will have a shared knowledge and experience, and all of us, I would say, will try to do or help someone in the government side to understand the need and to establish the infrastructure of emergency medicine or pre-hospital care. Actually, that's why I think I'm glad you are one of my first emergency medicine community podcast series. So you're the first one I'm interviewing. I think I will probably interview more. However, that doesn't mean I'll probably only have to come back to you for another session for a different topic. Okay.
Yeah, I would be happy to.
And
One thing I want to say is that, I feel like the people who are pursuing emergency medicine, even being from Bangladesh, even if you don't get to emergency medicine as a specialty, you still have this platform, and we need to unite as a community to advocate for better resources, better infrastructure, because, I feel like the understanding is there that, you know, there would be a great benefit to having emergency medicine as a recognized specialty in Bangladesh, for now and also for the future as things change in terms of like climate change, in terms of like political issues, refugee issues. Um, things are going to be changing, and even now there would be a huge benefit to having a specialized doctor in the emergency department that is an expert in resuscitations, an expert in acute care, and able to manage a department very very effectively. I think it would benefit the Bangladeshi people a lot, and I think that the people who can speak the most about it are the people who have worked in those hospitals. Which I've only been there for 1 month, but people have been there for their entire careers, and they have this unique perspective that would make them great advocates.
excellent, absolutely, I totally agree with you. Even I've been working. I did work for 4 or 5 years in Bangladesh in different emergency department. Every hospital is different, and whoever is working currently, I do admire them, and they have a
Yeah,
very unique exposure. Most of them, they're probably unsupervised, but they're learning as they go, and
yeah,
that's why I would love to do this meet and greet sessions almost every week to have them motivated. And actually, I would at some point I would like to bring guests like consultants or attending like yourself and others to join us, and actually just to motivate people and just give them like inspirations and improve our shared knowledge. um, I think we have a good time discussing today with you, Adiba. Thank you so much for your time. Okay, and
yeah.
I'll
Thank
be looking
you.
forward for future sessions with you. And I'm sure Bangladeshi community might have a lot of questions for you, which
Yeah,
I might have to invite you for another session as a group. Okay,
yeah, that would be excellent. And I can provide my email, if to the ER Skill Lab, if there's anybody that wants to ask me any questions directly and has any personal questions. I'm happy to connect.
excellent. So, with that note, thank you again so much. I'm gonna have to say goodbye to you and see you next session. Okay.
Okay, thank you so much, Dr. Farouk. I appreciate it.
Thank you, Adiba. Bye.
Bye.